Hi, everyone. Thanks so much for joining us here today. I'm sure some people will still be joining the webinar as we move forward here, but we'll get started. Got a lot of stuff to cover today. My name is Sean Budden, and I'm the ergonomist with the Workers' Compensation Board. I've been working here for about 2.5 years. I studied kinesiology at university when I went to Memorial over in St. John's and did an undergrad and master's degree in kinesiology. And I was introduced to the field of ergonomics about 10 years ago and really wanted to be in the field ever since. I really like that you get to problem solve in real world situations and the outcomes are to make the workers and employees that you work with happier at work, more comfortable at work, more productive at work, and just generally safer in the workplace. And you also get to really help Nova Scotia businesses be more productive as you go along as well with the increase in productivity that you can see from employees. So when you really consider the amount of time that people are at work throughout their lives, you can really make a significant difference to both the workers and the workplaces as well as the organizations that we work with. So I hope you enjoy the talk here today, and hopefully you're able to take away at least something that you can apply and integrate into your own workplaces and your own organizations. A little bit of housekeeping. We'll have a couple of polls that you can interact with here throughout the presentation. And so we'll launch them and you can pick your answer, and then we'll discuss and share the results with you. While I'm talking, definitely feel free to ask any questions. You can put them in the chat section of the control panel, should be up on the right there somewhere. And we have a team that's taking a look at those, and at the end, we'll take a look at any of the questions and get to however many we can. There are a wide range of industries being represented here today with the amount of people that have attended, as well as there's a handful of students as well. So I thank everyone coming out here today, and I'll do my best to touch on examples as we move through here for the different organizations and for the different industries, but definitely feel free if I miss anything to throw any questions that might be specific to your industry or specific to the work that you're doing, and we'll see if we can get to those at the end. And there are resource documents, I believe, again, in the control panel over on the right, that I think there's 4 of them maybe, that we'll be talking about here today that you can take a look at as we go through. And if you don't get a chance to download them here today, we will send you out a link to those resources. And you can also find them all on our webpage as well, but I just wanted to let you know, just so if you wanted to take a look at them as we're moving through here today. So we'll hop right into things. So the session overview, we'll talk about what MSIs are. We'll go over what ergonomics is a little bit and why we use this type of approach for preventing MSIs. We'll really go over the 6-step prevention guide that the Workers' Compensation Board has put together and developed for organizations in Nova Scotia to really take a look at MSIs internally and see if there's any ways that they can prevent them in their workplaces. For the infographic there, you can see that really the shoulders in the back are the main sections of the body that are typically affected. So you can keep that in mind as well as we move through the presentation here. I really encourage you to think about as we go through the presentation here today, what your own organization and what your own employer does to account and try and control for MSIs in your workplace. And as we go through these 6 steps here, that you really try and think of, is there anything in these steps that we can try and integrate into your own work practices and procedures and health and safety systems. So I definitely encourage just to keep that in the back of your mind as we move through here. So I think we do have a poll to come up first here. So I think that should be open, and really just trying to get an understanding. Does anyone know what MSI stands for? So we'll give you a couple minutes to answer those. So we're sharing the results here, and it looks like we got a pretty smart bunch of people here today. So yeah, musculoskeletal injuries is what it stands for. So yeah, so musculoskeletal injuries, or MSIs, I'll probably refer to it as MSIs as we go through here today, just a lot easier to say. And it's really an umbrella term for a bunch of different injuries. So you can think of it as your sprains and strains. Carpal tunnel syndrome is another example, tendonitis, tennis elbow, all of these types of injuries that occur to your muscles, your tendons, your ligaments, nerves, and other soft tissues really are described by this, like I said, umbrella term MSIs, or musculoskeletal injuries. You may have also heard of repetitive strain injuries, overuse injuries. We're really all talking about the same types of injuries here. So however you want to think about as we move through the content today, that's different ways to think about it. And so as we see here, so 63% of time loss injuries, so when a worker needs to go off work, were MSIs in Nova Scotia in 2020. So that's a large portion of our injuries that require time loss are these types of injuries. So it just makes it that much important to have conversations like we're having here today, and really try and work together and work as kind of individual organizations to try and find ways that we can reduce the chance of these injuries occurring. So not only are these injuries are occurring a lot, but they also have a lot of costs affecting both the businesses and the employer, as well as the workers in our workforce. So for direct costs, so this $2,862 is the average claim cost of an MSI. And when I say direct costs, that's like your treatment, so your physiotherapy that might be needed, prescriptions that might be needed, as well as wage replacement benefits for needing to be off time. Because as we can see here, 9.3 is the amount of weeks on average that someone loses from work for this type of injury. So that's a significant amount of time that people are away from work on average, like I said, for this type of injury. Another big thing to think about is not only are there direct costs for physio and prescriptions and those sorts of things, but there's also indirect costs that go above and beyond that number. And as managers and supervisors and business owners, you may have seen this in your own organizations, but indirect costs would be like loss of productivity if you had to stop work or put any work on hold due to an injury like an MSI, and also other things such as absenteeism, or even early retirement, or someone needing to change their career path because an injury is no longer allowing them to work in that same industry. So lots of costs, lots of negative effects to both the businesses and the workers in Nova Scotia. So really shows the importance, like I said, of having these conversations today and working together to see if there's any ways we can reduce the chance of these injuries occurring. So now we know a little bit about what MSIs are and some of the negative effects they have on our workforce. Let's take a look at some of the prevention opportunities that we might have. So what is ergonomics? Ergonomics and MSIs really go hand in hand. So I wanted to include this slide here today. A lot of people might know what it is, but I wanted to include this slide just so we can have a baseline understanding of what ergonomics is and why we use it to try and prevent MSIs from occurring. So ergonomics is a science dedicated to matching jobs, systems, and environments to the capabilities and the limitations of the worker. And we'll talk about capabilities and limitations quite a bit here today. And it's really the important thing to understand that, especially when you're back in your own workplaces and at your workstations, all of the employees have different capabilities and limitations. And it's really important to try and fit the jobs and the demands of the job to those people and their own capabilities and limitations. And we'll talk about job demands versus abilities and limitations as we move through here today. And we'll take a look at the 6-step guide here now and try and find different ways that we can try and identify potential disconnects between job demands and capabilities and limitations within our own organizations. So here we have a kind of a high-level overview of the 6-step prevention guide for preventing MSIs. You can really think of it as a recipe. You can follow it to the T and get results, or you can pick and choose bits and pieces and kind of integrated into any already existing systems that you may have. The guide matches up fairly well with general health and safety practices, and so you can pick and choose different steps or different resources or information from as we go through and get a little more detail from these 6 steps. You can pick and choose some of it to implement and integrate into your already existing health and safety systems. For example, I'm working with a manufacturing company who has taken steps 1 and 2 and integrated them into already existing processes and systems that they have. So they already had an education system and program. They already had a way to identify hazards with their own workplace, and so they're taking bits and pieces and some of the tools from steps 1 and 2 and building it into their already existing processes. And then for steps 3 through 6, they're taking a small team of individuals and training them on the processes of steps 3 through 6. So your risk assessment, control, training, and evaluation, and any high risk tasks or jobs that are identified through their kind of typical processes for steps 1 and 2. They're getting kicked out to that team that is then handling those higher risk tasks and higher risk jobs, and then following through with a risk assessment, and then brainstorming controls and training and evaluation. So just shows the flexibility of the guide and different ways that it can be integrated into your organization. The way that we prevent MSIs from occurring really involves changing the way our workers interact with their workstations, interact with the environment that they work in. So it's so important to include them in any steps along the way and anything that we're doing to prevent MSIs. And that's really why we see the consultation and communication overlapping all of the 6 steps here. And we'll talk about different ways we can involve employees in this process in the next slide here. So having conversations with your workforce really gets everyone talking about safety, really starts to build that consultation, communication, that safety culture. And so having conversations with those frontline workers, it builds trust, it builds buy-in when you do go to make changes to their workplaces, and it really improves the chance of success, really based on that buy-in, and they're part of the process, or they feel part of the process, so they're more likely to really engage in any changes that come along. Inviting employees and other groups to be a part of the discussion is also a really effective way to get ideas about hazards, what might exist in your own organization, as well as solutions to any of the problems that you might come up with. Employees that sit there and do the same jobs day in, day out, they have a really keen awareness of what goes on in the intricacies of the job, and so they might have already come up with different solutions to problems that you're finding. So it really makes it important to have conversations with them about their job and different concerns that they might have. Ways to involve employees. So engage workers in the process of identify hazards. So if you have a hazard ID process, make sure that you're connecting with workers, maybe bring them along for any inspections that you're having to engage them in that process. Educate employees about hazards and signs and symptoms, and we'll talk about education here in a little bit, as well as evaluate the current level of awareness about MSI hazards and set goals for improvement. So really, like I said, have conversations and engage your employees to figure out where their level of awareness is and level of understanding about MSI hazards, and then set goals for improvement. Big way to improve awareness about MSI hazards is through really increasing the number of opportunities that you give your employees to learn about this topic and to engage in increasing their knowledge. So step 1 of the process and step 1 of the guide is really that education and awareness, and building that safety mindset, building that safety culture, specifically around musculoskeletal injuries, your sprains and strains, those types of injuries. And so safety awareness opportunities look a little bit different for every organization. One good way to increase the opportunities for learning is through lunch and learn sessions. I was able to be a part of one organization's lunch and learn day. They brought me in to talk about office ergonomics. They had a large office base and people were working from home. And so I spent an hour with them talking about different ways, like the foundations of setting up a an office workstation at home and in the office. So talked about different heights of monitors, the pros and cons of using a laptop, external keyboard, external mouse, and those sorts of things, chair height. And so that was really spent an hour with them to increase the ability and the awareness of those employees for kind of a foundational knowledge of setting up an office workstation. So that's one example for that. Toolbox talks are another big one that some organizations I work with use. Some people use toolbox talks at the start of every shift, and some people use it on a slightly less frequent basis. But they're also a great way to engage employees in conversations around discomfort and concerns and frustrations with their work, which is a great way to, again, start that conversation about different musculoskeletal injury hazards and opportunities for improvements. Best practices is another great way to kind of build education and awareness, really optimizing and improving how employees do their work. One example of this, I was working with a education organization, and they had identified a role within their organization that was a higher risk, had a couple injuries in it. And so they took that role and they broke the role down into a bunch of different high risk tasks, and they formulated a team of management as well as frontline workers to go through and find the best and safest ways to be doing each of the tasks. And then they built out a education platform and training videos on how employees can and should be doing those different tasks and kind of a safe work procedures. And so now they have that content that new workers can go in and educate themselves on, and they can have it as an annual training if they would want to. So again, just the importance and different options for kind of building out best practices and safe work procedures on tasks that have a higher risk for MSIs. Continuous improvement teams another option. So this is more establishing a team to focus on MSI prevention. So I talked a lot about trying to like build in and incorporate MSI prevention strategies into your already existing health and safety system and processes. The continuous improvement team is kind of having a separate team that is in charge of all that. It would be kind of like your JOSH committee, but they would have a specific focus on MSI prevention and supporting that education and awareness activity. So that's a different option to really kind of spread the education and knowledge. So once you figured out what your delivery method is going to look like for educating your workforce on MSIs, you really want to figure out what the content really needs to be. And so for the training content, I think at the foundation, we're all workers, and so we all should have a foundational knowledge of your signs and symptoms, hazard and risk factors, policies and procedures, and use of controls. And then anyone who's a JOSH member, a rep, a supervisor or manager, or maybe a part of that continuous improvement team for MSI should really have additional knowledge about how to control for MSI hazards, how to recognize indicators for MSI hazards, analyzing injury and incident reports specific to these types of injuries, as well as if you are using any specific tools in your organization for MSI hazard identification or risk assessment. They should also be aware and understand how to use those. So some different options for training content. And really of all the topics here, if we're gonna have people understand about how to identify different tasks and jobs that have a higher likelihood of someone developing an injury, we really need to understand the risk factors that are associated with a higher chance of injury. And so we'll talk about those here. And so the main 4 risk factors, you may have heard about these before, but it's repetition, posture, your awkward or improper posture, managing heavy physical loads or high forces on the body, inadequate breaks or long duration. We see that a lot with office workers because they're sitting for 8 hours a day, sometimes moving for only lunch. And so it's really making sure that we're breaking up that day. Other considerations would be temperature, so your extreme cold or heat, vibration throughout the day, whether you're using tools, contact stress, so that's leaning up against a hard object and having it contact the skin in an uncomfortable way, and psychosocial factors as well. And so remember when we talked about the capabilities and limitations of a worker, and we're always trying to think about those compared to the job demands that we have in our workplace. And so when we think about job demands, we really want to start thinking about these 4 main risk factors as well as the other considerations as well. So job demand, so if you have a more frequently repetitive task, the job demands of that task is going to be higher. If you have really awkward postures, so a lot of crouching, reaching above shoulder height, twisting or anything like that, you're going to have a higher demand for that job. Same thing with physical loads and inadequate breaks. So the more risk factors you have in a task and the higher the demands, the closer those demands get up to the limitations and the capabilities of our workforce, the higher chance and the more likely we are to start to see the body break down, and the more likely we are going to be to see these types of injuries come out. And so it's really important to kind of think of those and keep those in mind as you're walking through your organizations, and a little bit different way to think about job demands in the real world. So risk identification. So we talked about education, the delivery methods, the content that we should include. And so now it's really going on to the next step of trying to identify where the risky tasks are, or understanding the hazards. And so a more mature safety program is really going to be on the proactive side of assessing for MSI hazards. And that's really the thing you want to strive for. And so a review for a proactive approach would really include reviewing workers' comments, feedback, concerns about their job, frustrations with the work and the way things are being done a little bit. You could also look for MSI hazards during work inspections. So we talked about, if you already have ways to identify hazards in your workplace, making sure those processes and documents account for MSI risks and hazards. You can also use MSI hazard specific tools, and we'll talk about a few of them in a bit here, but that would be the kind of proactive review in trying to identify what can hurt you in your workplace specific to MSIs. It's important to have that proactive approach, but it's also really important to not leave behind the reactive approach, and this review would really include your incidents that are occurring, first aid, near misses, that sort of data, as well as accident or investigation reports. And also I'll put discomfort surveys that we'll talk about a second under this as well. Really important to keep that data, because it might start to show you different clusters or areas that you're having injuries, and gives you a more comprehensive review of what's going on. So definitely important to move towards that proactive approach for prevention. But the data and the incidents that are occurring, it's important to keep those in mind as well. So I think we have another poll that will come up here. And so really just trying to get an understanding of when was the last time that you've identified either ergonomic hazards in your workplace or MSI hazards. And you can think back to we were talking about the demand. So your highly repetitive tasks, your awkward postures, twisting, those sorts of things. Or you can think of even just like manual material handling would be an ergonomic hazard that you might be able to identify in your own workplace. So I think the results are up there, and I mean it's great to see the amount of people that are trying to identify these types of hazards. We had a pretty good span there from daily to this year. A couple people under the never category, and I think the results and the answers for this really show that it really depends on what your role is in the organization. If you're a safety manager who does quarterly inspections or something like that at a few different locations, you might have answered this month or this year for identifying those hazards. I think one thing that I think it's important to remember and make sure that our frontline workers know is that they should be identifying these hazards, and maybe even more importantly, understanding the hazards on a daily basis. So when they go to their workstation or go to their work sites, they should understand and be able to identify these hazards on a daily basis, and understand either their best practices, their safe work procedures, or the things that they should be doing to control for the level of risk, whether it's something as simple as lifting properly, or it's something a little more complex like using an engineering control that's been put in place. But it's really good to see the amount of people that are working on identifying these types of injuries and risks. So we'll talk a little bit about the tools we have here. So there's 3 tools that the Workers' Compensation Board has developed for organizations to try and identify hazards and prioritize the risks within their own organization. So we'll talk about these here now. So the first one up, and just as a bit of a side note, so these tools are the ones that are in the resource section that you can download. So the first one up, this is the risk mapping tool, and this is a kind of a visual representation of what the end result is for it. It's a very high level tool that allows you to start to prioritize what injuries are occurring where in your organization. And if you have different locations, you might have different maps. If you have one location, you might have one map, for instance, the example here. And if you are looking for a map or a diagram of your facility, the fire exit maps are a great place to start for a diagram of your facility. So you can start there, and it's really just taking your injury data, so any incidents that have happened, near misses, first aids, and plotting them on the map to get a visual description of, again, like I said, what injuries are occurring where, and it gives you a systematic approach to try and really prioritize your efforts and resources into the areas that might need it most. So this is a great kind of first step in identifying where you may need to start, and it gives you an idea of what injuries are occurring and where. This can be a great activity for your job committee or any other safety group that's already looking at incident information and reviewing the incidents in your workplaces, whether it's near misses or time loss incidents. They're already looking at this information, so you can use that and utilize that to have them own this tool and have them maintain it. So moving on to the discomfort survey. So the risk mapping is a very high level kind of organizational strategy to prioritize where the injuries are occurring. The discomfort survey is more a tool used at a job or a role level. And so you might have workers who all perform the same tasks or all perform the same roles, and that's who you would want to use for the discomfort survey. It really shows you which parts of the body are experiencing discomfort, and it starts to attach tasks that are associated with that discomfort to the body parts. So you can kind of think of it as a risk mapping for the body. It's also a really great way to engage staff about their work. We talked about including frontline workers in all steps of the process, and I love this tool as a way to engage and build those channels to start talking with the frontline workers about discomfort, about frustrations with their work, try and find out what jobs they find most difficult or that nobody wants to do. And as you start to use this tool, you start to see the tasks and the jobs that no one wants to do, that they find most difficult or most awkward. They come up a lot, and that's a great area that you can kind of start to prioritize your efforts and resources. And it's really a great kind of early intervention. I'll also think of this as like a near miss reporting almost for MSIs, because MSIs can creep up, they can develop over a period of time, and without actually talking with the workers and trying to understand their fatigue levels and any discomfort they might be having, we kind of just see the end result of someone got injured performing a lift or a movement that they've done 100 times before. And so I kind of think of the discomfort survey as a near miss reporting system or early intervention system to try and get ahead of those injuries that might be kind of starting to break down our workforce a little bit, and we might not know that. But it can be a very flexible document. I've had some organizations use it just as a paper survey. They send it out to the workforce, and everyone fills it out and sends it back, and they kind of catalog the information that way. Other organizations use it as more of a conversational tool. So say during a toolbox meeting, the person running the meeting might take the survey and go through the questions and the information, and more of a collective conversation with the group, making sure that they all kind of do the same tasks and do the same work. You can have kind of a collective conversation about the discomfort and the hardest parts of the job, and start to attach tasks to discomfort, and start to have the conversation about, do they have any ideas or ways to make their job easier, more comfortable, more efficient, those sorts of things. So those are two ways that you can use this survey, but it is fairly flexible, and I've seen it be successful in a couple different ways. So the third tool is the workplace inspection checklist. This one, so the risk mapping is kind of a really high level organization strategy. The discomfort surveys at the role or job level. The workplace inspection checklist is really more at a task level. So we're kind of getting closer to like a root cause of an injury or something like that. It's an observation tool. So it's meant for one individual to go out on the floor and complete the checklist. It's fairly easy to use. It's a yes or no checklist, and they would go through observing a task being completed, and any answers that end up in a yes would be a higher risk task or a higher risk movement or posture. And again, it's all about trying to prioritize your resources and your efforts, making sure that you're correcting the bigger problems, but you're also correcting the right problems with a task. So it's a observational tool at the task level, and allows you to really systematically get an idea for where those high risk movements might be. And again, it's fairly easy to use. You can also build it into an existing hazard identification procedure. You can take bits and pieces out of this. If you have a hazard ID program and template and document, you can take bits and pieces out of this to make sure that you're accounting for MSI risk factors and MSI hazards in your general hazard ID program. I've also had an organization, it was a manufacturing organization, and they use this as more of an evaluation tool. So they had their separate procedures for IDing MSI hazards, and they had a process for controlling them, and then their supervisor and management level would use this tool to go through and evaluate the risks and the controls to see if they're working. So they would take this out on the floor, they would find their higher risk movements, but then they would really be concentrating on the controls that should be in place. And in the comment section, they would be making sure that the controls are being used and being used properly. And if they weren't, that was an opportunity to talk to the workers about why they might not be using a control. And maybe that control is making the job too difficult, or it doesn't work the way it was intended to. But again, it's another way that they can use this tool to have conversations and evaluate if their controls are working as intended. And so now that we've identified the hazards, we've gone through the education step, we've identified some hazards and some risks. Really the next step is to get a clear view of the degree of risk. And so not all hazards and risk factors lead to MSIs. So if we have a repetitive task, that doesn't mean that we're going to have an injury. If we have a couple awkward postures, that doesn't necessarily mean that we're going to have an injury, but it does start to increase the chance of injury or the risk of injury occurring. And so we really need to quantify the worker's exposure to the risk factors. So this is the step that you're going to start to take a look at, the reps per minute or hour. So how repetitive is a task? You might want to look at the weight of an object, the change in height for a lifting task. So what's the distance or what's the elevation that someone has to lift a box or any material, and also looking at the time to complete a task. So is this worker doing this task for 8 hours a day, or is it 2 hours a day? And again, it's all about kind of quantifying and getting a number for the level of risk. One example I like to use is for noise hazards. So we understand we're in a workplace. You can understand that there's a level of noise present, but sometimes it might be hard to know how bad is it, how loud is that noise, and also we might not know what's the different workers' exposure to the noise. They might only be in this area of the organization or the facility for certain periods of the day. And it's really no different when we think about musculoskeletal injuries and MSIs. We know there's repetitive movements. We know there might be an awkward posture or a heavy object that they have to move, but how bad is it, and what's their exposure to it? So this is the area that we really try to figure all that out, and get a numerical value for the level of risk. So in the ergonomics profession, there's a wide variety of different tools that try and help us quantify the level of risk. So early on, we talked about people's capabilities or their abilities and their limitations, and now we're trying to get a clearer view of the degree of risk, or how bad is that task, how bad is that movement. And these tools really bring together an understanding in the ergonomics field's understanding of what people's limits and capabilities are, and it compares them to the demands of the work by filling out things like the weight of objects, the distance they have to carry things, the different postures and durations that are in the workplace. It really allows us to compare the demands versus people's abilities, and come up with a numerical value associated with a level of risk. So that's really what these tools are able to do. And most of the tools do it in a slightly different way. You can see the top three are general MSI risk assessment tools. The middle ones are better for your upper extremity risk assessment. So if you have someone on an assembly line and their lower body is very static, but their upper body is kind of moving and working with the assembly line, that's maybe a tool that you would want to look at. And then the bottom three are your methods to assess your manual material handling. So really good for your lifting, lowering type of tasks. We really recommend the quick exposure checklist. It's really good because it's a general MSI risk assessment tool, and it was developed for general safety individuals in mind. So it's fairly easy to learn how to use, fairly easy to use in the workplace, on the floor, and it gives you a great wide range of different tasks that you could assess. So that's the one that we recommend a lot, and one of the assessment tools that I work with organizations on. Another option and very commonly used is the NIOSH lifting equation. A way that could be used, I had a agricultural organization, and they were looking at bringing in automation equipment to their organization, and they were looking at two different workstations, and we're trying to figure out, they only had the funds to bring in automation equipment for one of them. And so really using the NIOSH lifting equation allows you to get a numerical value for the degree of risk. So you can start to compare and contrast, kind of apples to apples, different workstations, and use that information in a business decision, along with any other information that goes into it when you're trying to figure out bringing any equipment on board. So that's just another example of some way these tools can be used, and just the flexibility of them. So we assess the level of risk. We've got that numerical value. Really the next step is the control implementation and the brainstorming of the control. So the first step of this is to try and find really where the problem is coming from, or do a root cause analysis. And you can use information from previous steps to make sure you're fixing the right problems. You can go back to the risk identification stage, make sure you're using employee feedback from the discomfort surveys, and also use information gathered during the risk assessment. And you want to define the problem, collect the data from the previous steps, identify possible causal factors, and make sure you're identifying the root causes. One example I have of this, I was working with a long-term care facility, and some of their employees and workers were reporting concerns over pushing large linen and laundry carts around the facility. And so we started to talk about different reasons why this might exist, and looking at different ways to push the carts, making the carts lighter, changing the sizes of them. And through conversations with the frontline workers, it was really when the carts were weighed down with a lot of linen and a lot of laundry. And we found out that it was actually the wheels that were causing a lot of the difficulty. So the wheels originally had stationary wheels in the back, and they had rotational wheels in the front. And so when it was really weighed down, it's kind of like a grocery cart in that way. And so when it was really weighed down, they were having trouble pulling it around different corners to maneuver around the facility, which was very difficult for them. So the solution was to change the wheels. And so the stationary wheels were in the front and the rotational wheels were in the back. And so this allowed them, even when it was weighed down with laundry and linens, it allowed them to swing the back end around a lot easier to maneuver around the facility. So just really emphasizes the importance of trying to figure out the root cause of the problem and what define the problem, and really kind of figure out what we want to put our resources towards. So any safety professionals out there, or anyone involved in safety, has probably seen this before, but once you've identified the root cause of your problem, you really want to start brainstorming controls. It's really important to involve frontline workers and actually as many people as you can from different areas of the business in this process, and start to brainstorm different controls for the root cause and the problem that you've identified. You always want to start with the most effective first, so that's your elimination, substitution, and then work your way down through engineering controls, admin, and PPE. For musculoskeletal injuries and these types of controls, it's really no different. You want to go through the same process. You typically end up with either an engineering control or an administrative control, and sometimes PPE. And actually with a really good engineering control, you're kind of eliminating and removing the hazard anyways. For example, if you have a lifting hazard and someone's lifting a box multiple times a day, and you bring in and build an engineering control of like a vacuum hoist to now lift that box for the worker, you're actually removing the hazard for the worker. And so an engineering control, when done well, actually kind of eliminates the hazard anyway. So same process when you're trying to look at MSIs and control for them, and it's done really well in like a group brainstorming session, and make sure that you include frontline workers as well as other groups like someone from maintenance or engineering, just to get a wide variety of eyes. Typically ends up with the best results. These are some sample controls just for an idea of what options you could end up with. So location of materials, you want to make sure that your heavy items are stored kind of in your strike zone between your knees and your shoulders. For working zones, especially if you're at an office desk, you want to make sure your keyboard and your mouse and your phone, if you use it a lot, is in closer to you, so you don't have to reach far to get it if you're doing it repetitively throughout the day. Overhead work, you would want to either try and bring your body up to do the work so it's in front of you, or you want to try and bring the work down so that's in front of you. That's really the two options you would have there. For visual zones, again, for the office workstation, you could make sure that your monitor is right in front of you. If you are using the dual monitor and you use them 50-50, you want to make sure that you bring them as close together as possible, and have them equally in front of your vision, and make sure the top of the monitor is at your eye level for that optimal visual zone. The power grip is definitely your strongest grip and most optimal for the hand, instead of like a pinch grip or something like that. And finally, the job rotation. So if you are rotating people through different jobs, that's a great administrative control that you can implement. The biggest thing with that is you want to make sure that you're changing the muscle groups that the worker or the employees are working. So you want to make sure that you're not taking a worker from a very high shoulder repetitive task and putting them on another high shoulder repetitive task. So you want to make sure that you're alternating positions and body movements and muscle groups that are being used. So that's a big one on job rotation to keep in mind. So once we've brainstormed and agreed on the different controls that you're going to implement. The next step is really to train your workforce on the controls so that they know how to use them. So training should include education on the hazards and risks identified, proper use of the controls. So if you're especially engineering controls or anything a little more complicated that might be involved, you want to make sure that you're training your workforce on that. Maintenance checks and schedules for equipment so that you're not bringing in any new hazards to play. You want to make sure your equipment is being maintained. New safe work methods or procedures is a big one. If you've changed the way people are supposed to be doing the work, you want to make sure that they're trained on that, and any required PPE. Big one of this step is it kind of creates that full loop with the process. So any training, this training here kind of is specific to the controls that you've implemented, but you want to make sure that you take this training content and then you loop it back into the education in step one, so that either new employees going through orientation or employees that are changing workstations, or even maybe on an annual basis, you're doing refresher training. So you want to take this content that you've built on the control and kind of loop it full circle back into the education content at the beginning. And the final step is really evaluating your plan. The goal of evaluating your ergonomics program or your MSI program is really to determine that if the processes and systems that you've put in place are working as you've intended. The more areas that you're evaluating, the more accurately you're going to be able to determine which parts of the system are working and which parts of the system might be resulting in people just kind of going through the motions. For example, if you say you're implementing safe lift training and it's online perhaps, and so you get people to watch the videos and you're measuring the amount of people that you've trained, and say you've trained your entire workforce on safe lifting, and then if you see that you start to see some injuries on lifting, you might actually not start to look at the content or that training to see if it's working. You might start to look elsewhere. But if you have a variety of evaluation metrics and tools, and say you're also tracking knowledge retention or application of the training somehow, you might be able to pinpoint that actually, yes, people are seeing the training and going through the training, but they're not actually taking that information and transferring it to their day-to-day work lives. So that's a specific example, but just kind of shows the importance of tracking a variety of different metrics. So you can try and, if you do start to see clusters of injuries or some things pop up, you can be a little bit more able to pinpoint where the problems might be arising from and focus on it that way. So that's really the end of our content here for today. I know we ran through a lot of that fairly fast. These are the resources that we talked about earlier. So the how to prevent them in your work, that's the overall guide for preventing MSIs. We have the discomfort survey that I talked about that you can send out to your workforce and get the feedback back from them, the workplace inspection checklist, the risk mapping tool, and then an office ergonomics guide as well. So these are all available in the resource section. They're also available on our website, and I believe we'll be sending out the links to everyone that was here and participated today as well. So we will move on to the questions. Nicole has been collecting them in the comment section, I do believe, and so we'll go through them here now if there are any, and hopefully try and answer as many as we can and have time for today.
Good, thanks, Sean. Hi, everybody. Thanks so much for your participation today. We have a few really good questions to go through in about 10 minutes left. I just wanted to let everybody know Sean is going to get to as many as he can in the time we have left, and if he's not able to get to your question, he will reach out to you directly after the webinar, or his contact information is listed on the screen. So we'll start with one from Jonathan, who asks, how widely would you recommend sit stand desks? I commonly hear two opposing arguments that while they provide the ability to modify posture while working, they discourage employees from stepping away from their desks for breaks or micro breaks, ultimately hindering their mental health. What are your thoughts?
My thoughts are they can be beneficial in a specific situation. I mean, one of the issues with office work in general is that we're in a seated position for a long period of time. And so if we're specifically looking at that as the risk factor, then yes, a sit-stand desk does break up our posture. It changes from a sitting posture to a standing posture. So that is one benefit of a sit-stand desk. The other one is that a sitting posture puts a lot of compression forces on our spine. And so if you're having low back pain, a standing posture can sometimes reduce the amount of compression forces on our spine. And so that is one potential. So someone that might have pain sitting down might not have pain standing up. And so that's another potential benefit. I think the issue with, like you said, a big issue with office work and kind of the computer work in general is that while yes, we can change our posture and go from seated to standing, they're both static positions. And so we need to get moving more. And the sit-stand desk doesn't solve that problem. So that is a problem that would still exist even if you do have a sit-stand desk. So I think it's important to, if someone does have a sit-stand desk for the reasons I just kind of mentioned, it's also important to let them know that we still have to get up, move around, and that could be even more beneficial than just changing your postures from sitting to standing.
Great, thanks, Sean. Another question from Lori, who asks, what training would you recommend for JOSH committee members to start with?
I'm guessing this is like MSI specific or ergonomic specific.
Yes.
I think I would recommend with starting to be able to identify hazards for MSIs and ergonomic hazards. I think it really starts there, because once we start to get a really good understanding of where the risks are in our environment, what can cause an MSI in our workplace, once we're able to start to answer those questions and kind of get a list or a collective agreement of what those are, then we can start to prioritize them. Like I said, go through that risk assessment. How bad is that hazard, or how bad is that movement? Start to quantify the level of risk, and then we can talk about controls and go from there. So in terms of training for a JOSH committee, I think it would start with being able to identify and understand the hazards and what leads to these types of injuries.
Great, thank you. Question from Victoria, who asks, where do you see ergonomics fitting into play with workers who work on uneven ground all day? For example, on a construction site. If you're walking on uneven ground all day, this can lead to MSIs as well in your knees, hips, and ankles.
That's a good one. I mean, I think I would probably go back to looking at the demands versus our capabilities and limitations. So if they're working on uneven ground all day and starting to have ankle, knee, and hip issues, I mean, proper footwear would be a big one to make sure that they have the proper grip and support for their feet, obviously, keeping into consideration other health and safety, steel toes and that kind of stuff that they would obviously need on certain sites. That's a bit of a difficult question. I mean, I think it would be looking at the duration that they're working. Is there any breaks that they can get from walking around on uneven ground throughout the day? Can we make that ground even? That would be a question I might have. But yeah, it would be looking at any ways we can make the ground even, or try and find a way that we can break up the duration that they're walking around on that uneven ground.
Great, thank you. We have a question here from Jennifer, and this one came in on the slide where we had some more resources listed. So Jennifer is wondering if you have any recommendations on resources that would be the best fit for patient handling.
For patient handling, I don't know. I don't really have what the best resource offhand would be. I'd have to look into that and get back to you just to make sure I was giving you the best resource I possibly could. But we can definitely connect with you and provide any resources that we might have.
Great, we'll follow up with Jennifer for sure. Tamara asks, can you just describe or provide a few examples of some PPE that is specific to preventing MSI?
It would really depend on what type of injury you were trying to prevent. And so when we think back to the risk factors, I typically think of PPE. So when you're looking at your cold exposure or your temperature, so if you have like extreme heat or extreme cold, PPE could be appropriate clothing or gloves just to make sure that the body is at at least somewhat appropriate temperature. So we're not experiencing that extreme cold or extreme heat, which again fatigues the body a lot faster and makes us more likely to develop one of these injuries. So that could be a PPE that we're looking at. If we're looking at vibration, some people in different roles in industries might want to look at anti-vibration gloves. For that, it is very important to make sure that you're not creating a new hazard. So if you're introducing anti-vibration gloves, making sure they're not clunky or they're not decreasing grip strength or anything like that. So for anti-vibration gloves, I definitely recommend trying a few. I think there's a lot out there on the market. So getting the workers that are doing the job to try a few different gloves to see what works and what works best for them. At the same time, trying to reduce the vibration that they might be exposed to.
Great, thanks, Sean. So we actually have a couple of questions around the move to work from home. So I'll kind of just merge them. So Dustin asked, with the push to work from home, did we see a spike in MSI cases? And a question from Matt who asked, with COVID-19 and the shift from the office, how can employers ensure workspaces are set up properly at home with less control over the environment?
Yeah, so the first question, I don't have the data actually to see if we have saw a increased spike of MSIs related to office injuries. The overall MSIs has stayed fairly consistent in terms of pre-COVID and now. I know it's changed a little bit, but we didn't see a massive overall spike. But again, I don't have the breakdown of the data for office specific MSIs, which I think is where you would need to look to actually see if there was an increase or not. I think for the second question, making sure that our workforce is set up properly, I think in step one here today, we talked about that education and awareness. I think that's a big part of that, making sure that our workforce understands the different risks or hazards that are exposed to them in that kind of office workstation setup, and also give them the awareness and knowledge to appropriately set up their workstation. I think workers want to be in a comfortable position. They want to be in a productive position. And so if we give them that knowledge and kind of awareness to set their workstation up appropriately, I think they would be willing to do that and want to do that. I think the step after that is that making sure that they have the equipment and resources to have a proper setup, and also allowing them and making sure our workforce knows where they could go if they're having if they have all the equipment they need and they're still having some problems, making sure that they have a next step that they can take kind of internally with your own organization to get some additional help if they're having trouble setting up their own workstation.
Great, thank you, Sean. We do have a few more questions. I think we're only going to have time to get to one more, but as said, Sean will be happy to follow up with anyone after the session if he hasn't had a chance to get to you today. So we have Kawaja asked, can you describe a few steps for safe manual handling of a load?
A few steps for safe manual handling?
Yeah.
I mean, manual handling is very broad. I mean, if we're looking specifically at like a simple lifting of a box or something like that, I mean, you want to make sure that your back is straight. Obviously, you want to lift with your legs, so getting down in a squat type position and making sure that your back is straight and you lift with your legs is probably the most important part. We see a lot of injuries occur when we start to round the back or change the flexion extension of the back during a lift or a movement. Twisting and turning is also a really big one. Any manual handling tasks that you're doing, you want to try and avoid twisting the spine at any point in the task. So I would say those are the big ones, especially when we go back to our first infographic. We had the back is one of the main areas that we see injured, and lifting is one of the main injuries that or causes of those types of injuries. So making sure the back is straight during the lifting with the lower body, and making sure we're not twisting would probably be the biggest things on a general scale.
Perfect. Thank you, Sean. So I believe we're at time if you wanted to wrap up.
Perfect. Yeah, definitely appreciate everyone coming out here today, and thanks for joining us and having the conversation around MSIs and prevention. We will be sending out a survey to everyone here on the call today, just to try and get your thoughts of the webinar and input on any improvements we can make on future series down the road. So yeah, I think that's it, and definitely thanks again for joining us today.
Great. Thanks, Sean. Thanks, everybody.